just joining us, please put your name and your county in the chat and your role. And then if you're inclined to also let us know what you think whole child supports or systems mean. And if you have a question coming in, please put that in the chat and we'll be monitoring the chat. So throughout the evening, just feel free to put questions in the chat or comments. And I know we're still gathering, but I think I might just say a few words about ACCBE while we wait for more people to come on. Most people know this. So can we go to the next slide, Debbie? So here's our agenda. We're just doing a little overview. Then we have our two great speakers who'll be talking about whole child supports and AB 2083 and integrated services. And then we have Ventura County, both staff from the county office and from the probation department talking about their actual partnership and all the good work they're doing and the success they're having as a result of this interagency work. And then we'll have open discussion. I think we have some really great reflection questions for y'all. And you'll see there's a few times that we'll stop and seek questions and from the participants, and we encourage you to use the chat box to put your questions in as well. Next slide. So we are 46 members strong out of 58. Plumas County just joined. We're very excited. We're still working on a few more, but we are so thrilled to have the 46 who've joined, and you'll see all their logos there. Next slide. And then ACCBE we're in our second year. We're all about empowering county board members to be confident advocates for students. And our vision is that we are the leading voice for California County Boards of Education, improving outcomes for our students, our families, and the communities they live in. And then our work is kind of in 4 buckets. We advocate at the state level. We have a bill right now we're sponsoring, and we've been supporting a few bills. We are all about partnerships and are really proud of our partnerships with the California County SUPS and another group called Reaching at Promise Students and the Small School Districts Association are probably the 3 partners that we've been really spending a lot of time with right now. We're all about empowering our members through trainings like this. We do one-on-one mentoring. We've done this year 2 in-person conferences, regional conferences. We have one more coming up in Ukiah. And we're trying to be forward-looking and helping our board members see possibilities and innovations so they can bring those back to their boards. And hopefully, we know we need to change the system. The systems are not working for a lot of our kids, especially ours in juvenile hall and community schools. So we're trying to promote new practices and new policies for our boards to be looking at. Okay, next slide. And our 2 key speakers, we have Dr. Elizabeth Estes, and I know her from Breaking Barriers. And I know she has a long history. I'm going to let her do her introduction when she starts her presentation. And then her colleague, Diana Boyer, is with the County Child Welfare, CWDA, County Welfare Directors Association. She does their policy advocacy work and has a long history of working in the field. And we're also very, very pleased to have her, 2 incredible experts. And then to help us actually put all the great things they're saying, show you how it unrolls in practice, we have some staff from the Ventura County, both the county Office of Ed, as well as the probation department. And so they'll be talking about their on-the-ground work. And with that, I think it's Elizabeth.
Okay. Hi, everybody. I'm Elizabeth Estes. I'm going to share my screen and some slides that Diana and I created to talk about some of the whole child work that's happening in California. Thrilled to be here. Really thrilled to be able to hear from Ventura on the ground and their work on the ground, and because the work that we do across the state or at the state level doesn't matter unless it's impacting what's really happening on the ground for our young people and those who are serving and supporting our young people. And so I'm just really thankful to have you all here to talk about that. I'm going to share my screen. I'm not great at doing this, but I am going to and try and get my PowerPoint up for everybody. Here we go. All right. So can everybody see this?
I think you want to click slideshow. Oh, there it
Yep.
loads. There you
Yep, perfect.
Look at me go. I'm learning. Even I can evolve. So really we're here to talk about whole child service delivery in the state of California. And I'll get to these slides of who I am. I'm running a nonprofit organization called Breaking Barriers, which I founded, frankly, as a result of my decades long career in the children's system. I started as a dependency and delinquency attorney in LA County. I represented minors in both the dependency and delinquency system for 6 years before I moved to representing the California Public Schools and county offices of education as an attorney, trying to build holistic programs for young people and realize the most robust outcomes we can for them. I happen to also be a mass shooting survivor myself with post-traumatic stress and recovery. And I founded Breaking Barriers on the notion that I was able to access what I need when I needed it. And a lot of our young people can't. And that one of the reasons why is that our agencies are not integrated. They're not united to serve students together all of the time. And I could see that in my practice, having worked in the dependency, delinquency, health, and education sectors. So I just started talking about how can we unite our resources better to better holistically serve our young people in every single county in the state. And that's what Breaking Barriers tries to do. And I'll let Diana, when she speaks, talk about her background, but that is what brought me to this whole child work. Today, we're going to talk about what is the role of county education boards in leading whole child efforts in the state of California. I did represent county boards for years, education boards, and so am familiar with your work and the programs that you're holding in your juvenile programs that you're holding and responsible for. I think as far as today's objectives go for county board education board members, really thinking about being knowledgeable about the whole child efforts that are happening in the state, really setting board priorities for whole child approaches and asking questions about this work and what's happening in the field in every county in California is really like one of the takeaways that we're hoping to impart. I'm going to talk with Diana about some of the whole child efforts happening in California now. I'm going to talk about what you might hear something about, which is ecosystem of care work that seems to be growing across the state. And then we're going to do some Q&A, but we're going to do the Q&A after we hear from Ventura and all of their whole child work because they're doing it, like I said, on the ground, and they can really speak to why this work matters and how it's impactful. So our audience today is agency leaders, board leaders, and really county leaders as a whole. As we're going through all of this, as County Board of Education members, I think it's kind of interesting to be thinking about how would this work impact students in the juvenile justice system and in the juvenile halls in your own county? How would this work impact students in foster care who go to our schools in your county? How would this work impact students with disabilities and IEPs in your county? How would this work impact prevention for students that are ending up in the juvenile justice system, the child welfare system, and or the special education system? And how overall would it impact outcomes for youth in your county, just as we go through this, thinking about that. I love this cartoon, which is the real life of many of the children that I represented. When it's a young child walking down the hall of a school who has hunger and sickness and homelessness, and probably other needs. And as he's walking down the hall, he's saying, like, could somebody help me with these things? I'm late for math class. And I think for me, this is about the fact that if we are focused on education, achieving the outcomes that we want for students, including their academic outcomes, we can't do that without addressing the whole child. It is impossible to do that without addressing all of the needs that that child has, and all of the challenges that are impacting their capacity to access our academic programming in order to achieve the goals that they want for themselves and we want for them. And those goals aren't just academic goals. Of course, we all know this. They're workforce goals, they're mental health goals, and social emotional goals. And so we really do, and I love this depiction of a child who's carrying so much. And I think it really shows how our agencies have to unite, because education doesn't hold all of the resources to address the needs that this child is faced with as he's in school. So I wanted to talk a minute about a pilot program that's happening in California to really try and realize more holistic services for children in 4 pilot counties. And it's called Transforming Together. It was funded and piloted by the California Health and Human Services Department. It's a multi-year initiative that aligns education, health, and human services agencies in order to build more holistic services and supports for children in these counties. It's currently focused on the demonstration counties of Alameda, Fresno, Imperial, and Humboldt. And this is the 3rd year of the pilots. And T-Squared is ending actually in July 1 of 2026. There's been a lot of learning around the challenges in trying to build a more integrated whole child system at the county level across our agencies and communities. And we're currently talking about what is the future of this pilot and this work prospectively. And I don't have the answer to that as far as this pilot goes, but I can tell you that there are lots of counties working on interagency coordination to best serve the whole child and maximize utilization of their resources at the local level to improve outcomes for youth. And I really look forward to hearing Ventura talk about their work. T-Squared, Transforming Together, really focuses on integrating a number of initiatives that the state has pushed out into the system after COVID. One is the Child and Youth Behavioral Health Initiative, which is the governor's mental health plan, which is a $5 billion allocation. One is the Community Schools Initiative, which is another $5 billion allocation. And then System of Care, which Diana is going to talk about, AB 2083, which is an already existing interagency body of work across agencies in order to build holistic services for youth in the foster care system. But that is really being expanded to hold all children in counties, in a number of the counties that we're working in, and certainly in these Transforming Together pilots they are building from their 2083 work. We have an implementation guide on ecosystem building, whole child system building, and that will be coming out in June of 2026. We're letting you know that as informational. And then we've been doing webinars actually with pilot counties on how do you build shared leadership in your county? How do you build shared goals for children of your county? How do you realize the most robust universal array of services and supports you can? And how do you do workforce development? How do you expand your workforce to meet the needs of the young people of your county as much as possible through utilization of some of the initiatives that the state has pushed out, like CYBHI. And then how do you realize shared financing and sustainability efforts as you are building your ecosystem and maintaining your ecosystem in a county for young people? We talk a bit in the guide and otherwise about why integration matters. Why does it matter? Why should we even care? What is an ecosystem of care? We see it as an expansion of system of care to all children. And the reality is that California has lots of initiatives. We actually invest in massive initiatives on the regular. Every single year, new initiatives are passed. Some of the initiatives here are community schools, CYBHI, system of care, CalAIM, enhanced care management. I could go on, and so could the people from Ventura. There's initiatives in the juvenile justice forum. There's initiatives in the foster care and child welfare work. There's initiatives in education. There's initiatives in early care. There's initiatives in aftercare. I could go on and on. And one of the challenges of the system is that as we catch the initiatives, they get implemented in silos. They aren't necessarily implemented together so that we can make sense of the resources and services and supports that they're offering to young people together. And so the work that we're really leaning into is how do you take the initiatives that exist in counties across agencies and communities and put them together to the most robust system you can. I don't think that I have to belabor this, but the data underscores the urgency. We still do not have the outcomes that we want for young people in the state of California. And I just cited some of the statistics here. We also have a budget that is shifting. We had a large budget surplus after COVID, and that is now shifting. And with that comes a necessity to really maximize our resources and our staff. And the best way to do that is to unite them in the most robust system we can. So we're working on how do you do that. But one of the other things that I just thought we could all talk about for a second here is why do you, as you sit here, whoever you are on our webinar tonight, why do you see a need for like an integrated, holistic system for our young people? Like what do you see as the necessity driving that? Or do you not? Are you like, we just could be all separate? Any thoughts?
Bina, I'll start. I'm hoping our other trustees will weigh in. There's two for me. One is seeing our students when they leave our court and community schools struggle to reintegrate and to have access to the supports they need, not only to get back to their schools, but to have the mental health and the housing and the other supports that they need to be stable. So that's, to me, I've seen it. We've seen it in the data. We've seen it through stories. And then personally, I put in the chat, I'm a CASA to a foster youth and an ed rights holder to another. And I see the system very personally and just see the fragmentation and how it impacts just the two students I work with. So that's my perspective. Other folks? Rachel, Louise, I see you guys.
Hello, this is Rachel from Santa Cruz County Board of Education, and we definitely partner with a lot of our nonprofits. And I think one of the important reasons for that is that I think when you think about students who are coming from foster care or from the juvenile correctional system, there is not just one challenge that they're faced with, and we expand our resources for them when we partner with other agencies. We give them a better chance of success. Not one agency can handle all of the needs of an individual. So it's really important to have those good relationships with those nonprofits and outside agencies. And secondly, the reality is budget and grants. We don't all have the financial resources to serve all of the needs of that one student. So being able to have great relationships and partnerships with these agencies and nonprofits is vital to the success for our students.
And this is Andy from probation. Hopefully I'm not echoing all over the place anymore. But I would echo what she said in terms of, Rachel said, about the importance of the collaboration. It's not just about education. It's not just about mental health. It's not just about jobs. It's not just about homelessness. It's not just about any one thing. Your illustration of that cartoon is spot on. So how does a kid that's dealing with those issues manage to even get to school? I'm in kind of a unique position here. Over the last 30 years, I've been a probation officer. I've been in this facility now through 3 very distinct eras: 2006, 2008, 2015 to 21, and then about 9 months ago, again, coming here as the chief deputy. A lot of changes, but the one thing that doesn't change is the collaborative efforts and joining with behavioral health. I mean, we put a lot of our agency's resources towards, we have an in-house school here. We have behavioral health therapists that are assigned. Each kid gets one coming in here. We have a population that's much more manageable now. So when we're looking at that transition out, talking about leaving court schools or justice involved, how do they get back out there? It's so important to have that piece that allows these youth to transition back into the community. And that doesn't just begin and end with entering school. That's what's their home life. What are they going back to in that? We have transition out to our field operations for what we start inside the facility here. I mean, the long and short of it is, collectively, we're certainly much stronger than the sum total of our parts. We do our bit in here as probation, certainly, but we rely on those VCOE, our partnership with them, and Ventura County Behavioral Health, and the support of the public health nurse that works out in our field offices, that's out visiting families to help broker those services. And that's really what the probation officers are doing out there in the field, and starting in here as well, is being that broker of services, knowing what's available out there for them. We need to get with these youth early on in this system, identifying what those needs are in here. And then once we've done that, how do we transition that back into the community? Because very rare is the kid that leaves here without some sort of community-based supervision, okay? That should equal support with the youth, absolutely. And, Ms. Estes, if you've been around the system, long enough, just every kid that we deal with here has been abandoned, abused, or neglected, or all three simultaneously. I don't offer that as an excuse for their behavior, but it certainly gives us some insights and some reasons. So I'll leave it at that, and I'm sure I can speak a little more later. You'll have to shut me down, undoubtedly. But it's about that collaboration is just huge, and we rely on each other's strengths to try to build these youth up, and those are the ones that we're putting back out in our communities. How are we equipping?
Yeah, they're where I started talking. They're we're all complex humans, and they are complex humans facing a lot, and they need us to unite our resources rather than asking them to go navigate a system that is not navigable for them. We have to do that for them to give them the best chance possible and build the best conditions for success. I mean, I just so identify with what you just said. So it's a good transition to this slide, which is really what we do. When we operate in isolation, both our agencies and the initiatives that we get, we then have families have to navigate in multiple systems. And Bina was saying she's a CASA. Well, it is very hard for CASAs to understand how to navigate the system for the young people that they're trying to support. It is nearly unnavigable, to be honest, for a lawyer representing minors to navigate the systems that are trying to serve them simultaneously, but not together. And most attorneys only know their silo. So education lawyers know education law. Juvenile justice lawyers know juvenile justice law. Probation, foster care lawyers know foster care. It's the same is true for everyone in these systems. We understand the piece that we know, but not the whole piece, and what are their holistic entitlements. And we're really working to change that. And the more you spend time together with the other agencies and make that your intention, the more you understand what the shared resources are that you can then go navigate and pull from. That is that collaboration is what, is really where we will build the conditions for young people's success. And our workforce strain increases, interestingly enough. There's research on the fact that when we operate in silos, it actually stresses the people who are trying to help young people out more because the system's unnavigable and then they can't get them what they need when they need it. So there's a lot of impact, not just on young people and their families, but also on those trying to support them. And then if we switch to a system where we navigate for them, we create the conditions where those arrows are moving inward and we're actually figuring out how to care navigate across our agencies by, for, and with them, you build a system that's more coherent for everyone and can maximize both our resources and outcomes, most importantly, for those we're serving. We took a minute in our work to look at whole child. There's a lot of discussions around whole child work. And then if you move over to the health side of the house, they talk about whole person. They don't really talk about whole child. They talk about whole person care. But those aren't really, those are separate too. So we actually created a shared definition, analyzing a bunch of the different definitions that are out in the field around holistic services for children, and found that they're the same. They all say child development is interconnected. You have one whole human. We need one whole system that supports them. The problem is really isolation across systems. It's okay if we have specialization. We need people to specialize, but we need to not specialize in isolation. We need to specialize and connect ourselves. So really, whole child is not something new. It's not changing everything that we have. It's aligning everything that we have so that we can understand it and better access it and provide these supports to young people. So our shared principles are coordinated across agencies, developmentally appropriate, individualized, strength-based, and also, just really importantly, that our work in every county on integration and a whole child system is shaped by youth and family voice, so that their voice is as important as anyone's in how effective our services and supports are for them. And what we find when we get family and youth voice is we learn things that we didn't otherwise know about how effective our services and supports are for them. This is a slide of what is really necessary to build an integrated system in any county in the state. It is shared vision, shared commitment to unite ourselves, our resources, and empower our families. There is structure, organization, and resources necessary. So we do have to take an integrated approach to child well-being. And Andy was talking about, some aspects of that, like they actually do coordinate across our agencies to identify and share resources. That is structural. That doesn't just happen. That's a structure that they've built in Ventura County to actually make that happen. And so we are advocating for these structures being built in every county across agencies. And then you need to build function, process, and outcomes, community-defined outcomes that we actually measure, effective capacities to share data so that young people don't have to tell their story 10 or 15 times to different people in different agencies in different forums. They can tell it once, and then we've organized ourselves so that we can get the information we need to care navigate for them. And then integrated financing can be maximized if we do this integration work. And I can give a couple of examples later of when we start to think about, what are we holding across the agencies and really braiding and blending those, you can start to bring in more revenue for young people and for the agencies that are supporting them. In the why, what, and how, what we wanted to talk to you all about, given the audience here, is really the role of county boards of education members. And system change, this sort of change, is not how we operate. It's not how the silos operate in silos. We're kind of raised in a silo, really, to work in a silo, unless you're in a county that makes this their intention, this integration, this unity. Ventura is one of those lead counties, honestly, and has been for decades on this work. And shared leadership comes first. We need leaders that say, we want to unite our resources for children to build the most holistic outcomes we can for them that they want for themselves and that we want for them. And so that is a role that county boards can have, is to say, we want this leadership to really create a commitment to integrated systems in our county, and to have the authority, the trust, the resilience, because this is not easy work, the shared accountability, to really anchor in the needs, assets, and aspirations of your community. And so really the role of the board members can be to be champions for this work and really incentivize this work at the agency level. Common challenges we find in our research is that without leadership, systems tend to return to siloed efforts. Sometimes we kick the can. To be honest, in my practice as an attorney for children in the system, I saw many situations where someone said, well, no, go to education, they'll do that. Or go to probation, they'll do that. Or go to so-and-so, they'll go do, don't, this is a wrong door. Go to that other door. Instead of, let me help you get what you need. Here, let me call in probation. Here, let me call in child welfare. Let me call in behavioral health. Let me call in First Five, whoever it is, so that I can help me call in the housing, homelessness, like employment, so that I can get you what you need. If we do not have leadership around this work, we find that the systems return to these siloed norms of like protecting themselves versus really protecting the young people. No single table sees the whole system. Andy said that. And we need our decision makers to be committed and aligned around this holistic work. We have competing priorities and outcomes. Sometimes we see implementation advances, but then it stalls. Oftentimes because someone will say, oh, they retired. The guy that was doing all this, he retired. Like, I really liked him, but like he retired, so it's over. And I'm like, wait, what? The holistic work for the children of California is over because John retired? Like, no. This has to be structurally how we operate, that we unite our resources. It cannot be dependent on, implementation advancing because of one personality and then literally falling apart because that personality has now left. So it is vulnerable work right now. And what we're really hoping to see is structures that stand the test of time, new operational designs, so that this is how we work. So when John retires, the work is still happening this way. The agencies are still united. They're still integrating. It's not just dependent on one human. How do we do that? We have really been advocating for the utilization of AB 2083, which Diana is going to talk about, system of care, to be a structure that every county in the state of California is holding. There is a mandatory MOU across agency to serve our foster youth that holds an interagency leadership team at the county level, then an executive advisory committee implementing that team's work. And then it's making sense of all of the initiatives and resources that we're holding so that we can build the most robust array of services we can for children. So we're really using AB 2083 as a structure in every county that already exists that can be used to really support this work. And I'm going to turn it over to Diana to talk about that, because this is
Thank
really...
you. So I'm going to talk about the initiative, the one initiative that didn't get the $5 billion, and that is AB 2083. It got $0 pretty much. And that's right. Like, it does, it started off as essentially a CWDA sponsored piece of legislation back in 2018, where we saw very complex foster children who were moving multiple placements, landing in congregate care. This is inclusive of probation, which also administers the foster care program for probation supervised children, as well as child welfare. And what clearly we recognized at the time is these were children and families that were experiencing multiple systems. And these systems were siloed, as Elizabeth noted, and we're not really talking with each other. And we felt these families were not being served adequately. And so we sponsored this bill, focused primarily on issues to address the current foster care system, to try to address their complex needs, to address the inconsistent trauma-informed care and agency misalignment, both at the state and federal levels. So this bill did actually also try to address this at the state level through a state level team, which does exist today, and also looking at the poor outcomes. And so 2083's work started with the goal of developing a coordinated, timely, trauma-informed system of care with key partner agencies. So we'll go to the next slide. So in the law on the left-hand side, you see who locally are the required state mandated partners: county child welfare, juvenile probation, of course, county offices of ed, regional centers serving our developmentally disabled and intellectually disabled children, and county mental health plans. And while not exactly specified in the bill, there is nothing that prohibits, and many counties have in fact expanded their local ILTs to include many others. Federally recognized tribes, for example, and other tribal partners, First Fives, county public health, juvenile dependency courts, and others. We'll go to the next slide. So in statute were, I would say, the recipes for creating the rules for how we would engage within these ILTs across these different departments and systems. So it specified the elements of what would be required for counties to create memorandums of understanding. This fell under the California Health and Human Services Agency. They officially released the guidance, also that although that guidance was co-developed with the Department of Education. So Department of Ed at the state level is also a partner. And that MOU outlines the roles and responsibilities, such as, and these are the key elements, although this is not inclusive of all the elements, but the key elements are committing to implementing the interagency core practice model, processing a process for screening and assessment, using child and family teaming whenever possible, developing information and data sharing agreements, addressing financial resource and sharing and management. So essentially putting our money in the sandbox, if you will, and seeing how we could collaborate together. There were other elements of the MOU, largely dealing with dispute resolution and also workforce support. Next slide. Oh, I think we're missing a couple slides. Okay. Anyway, I'll just conclude in saying that since we've established these MOUs, and you'll hear soon, I'm excited to hear from Ventura as well, that a lot of counties are leaning in. We started with a very small cohort of our foster care population and have really built out from there, and are going upstream because we see child welfare as the representation of where potentially other systems did not necessarily come to the aid in the way that those families needed, and it was too late. So I'll just, for example, I will implicate my own CalWORKS program in our self-sufficiency programs. We know that the majority of the calls that we get to child welfare are due to neglect. And we know that poverty is a corollary to child abuse and neglect. And when we could keep those programs and services, those cash aid programs, CalFresh programs for food assistance, basic health care, a roof over people's heads, we know that we serve them better and we can avoid that system involvement. But yet we also know that those families experience each of those systems, and this is an opportunity to look upstream. And this is where now we're starting to also look into our prevention programs. We have a significant investment that the state has made in prevention and the ability to tap federal dollars for things like in-home parenting supports, for mental health and substance abuse services. So these are also programs that many other agencies operate, county behavioral health, schools. And so it makes sense to align our resources because, as I've told our members, when we advocate for them, it is getting harder for me to get more funding for you from the state. It's just not a friendly environment for that. And so we all need to be smarter locally about how we go after those resources. Okay, now I'll kick it back over to you, Elizabeth.
Yeah, can we go after it together?
Right.
I've been talking about that lately. Okay, well, yes, thank you for all of that, and I'm sure you're going to have more to say when we get to questions. But one slide here that I included was just to show you all. You've probably heard that we have a large community schools initiative happening in the state of California, and it has gotten a lot of funding. It is getting additional funding. I do agree with Diana. I was hoping that we would have seen dollars in 2083 expansion previously, but we do have community schools work. And what I wanted people to see in this national coalition graphic for community schools is that in California, if we're doing community schools work, interestingly enough, the national graphic on community schools actually illustrates that it is essentially advocating for what we're trying to build through expansion of AB 2083, which is on the left side, a community-wide leadership structure, which in 2083 you would call an interagency leadership team, in an intermediary leadership structure, which is essentially an executive advisory committee, and then a school site community school leadership structure. And in the middle is all the same key system functions: community engagement, alignment and integration, professional learning, data and evaluation, finance and resources, policy and practice. So really, community schools in its national graphic is the same work as the 2083 expansion work. It's the same work. So it just, when I saw this, I thought to myself, wait a second, we really do need to be doing this together, because this really should be one large body of county work in every county to ensure that we're building community school systems, ecosystems, system of care ecosystems together that best serve and support our children and youth and those that are trying to serve and support them. They are not separate. They're actually trying to do the same thing. We have some strategies for building cross-agency leadership, which I will not belabor here, but some of it is mapping your cross-agency leadership tables in your counties. You may have numerous cross-agency leadership tables for young people, trying to really build more robust integrated systems for them. Figuring out what those are and how they can be united so that you can have the most integrated system possible in your county is really what we have been advocating for, and what a lot of counties in the state of California in their leadership structures across their agencies and at county board levels are really, really beginning to row towards. The work is really expanding quickly. I actually, before we do questions there, I wanted to turn it over to Ventura County to talk about their work. Because as I said at the beginning, I think the most important thing is the work that's happening on the ground. So would love to hear from you all about your work in this space. So I'm going to turn it over. Do you want me to stop screen sharing?
Sure, and I'll go ahead and start sharing on our end. Thank you, Ms. Estes, for the transition. And for those of you that we didn't get to meet at the onset of the Zoom, on behalf of our County Superintendent of Schools, Dr. Cesar Morales, and on behalf of our Chief of Probation, Chief Ron Miller, we just want to extend our deepest gratitude for inviting us to the conversation today. I'd like to take a moment to introduce you to the team, part of the team, who's going to be highlighting some of the leading practices and promising practices that we've had the privilege of being a part of. So starting with our Chief Deputy, Andy Souza, is on the call. Mr. Mike Winters, Director. You like the way that you just got promoted, Mike? Our Director of Student Services, Ms. Stephanie Rodriguez, our Director of Alternative Education. And also on the call with us is the individual that I have the privilege of serving with for the California County Superintendents, County Operated Schools and Programs, Mr. Nick Berger. He's from Contra Costa, and he also serves as the COSP co-chair. So just wanted you to know who's on the call for this segment, and let's see if I am successful sharing. I'm wondering, is everyone able to see the intro slide? Oh, I see the thumbs up and the nodding. Great. It's interesting as I was hearing Miss Williams from Santa Cruz talk about the importance of relationships, how we were hearing Miss Lefkowitz talk about complex systems, how we were hearing Miss Estes talk about complex cases, that we all have the privilege in our capacities to be able to navigate so that we could really do what is at the heart of a healthy ecological system. As I think of Bronfenbrenner's framework, that was the foundation for the adopting of healthy ecosystems in whatever industry sector we're in. It reminds me of three key principles that have led Ventura County to the place where it is now. And many of you already shared this. First and foremost, who is at the core of the ecosystem? And in what we have had the privilege of doing in our careers and our callings that we all have, we have always been student-centric, with the child always being at the core. I also think of like the second C, the second principle, which is communication, but most importantly, the bidirectional communication that takes place within an ecosystem, regardless of whether you're in the mesosystem, the microsystem, whatever layer we're in. And I would say that the most important is the collaborative relationships that we have with one another, with our families, and with our students. And I really appreciated everyone who opened and was really underscoring these foundational elements. As we reflected on whole child efforts and what is happening in the field, it was amazing to just pause and celebrate what so many county offices have been able to do since 2018. But even prior to 2018, so many county offices were doing this work. However, AB 2083 gave us a mechanism to formalize the practices that we were engaging in. And I think of like what is happening in the field, specifically with the partnerships, the teaming that has been established, and just the elevation of what the wellness system in Ventura County looks like. And so as we reflected on the ecosystem of care, it really brought us back to why we do what we do. It's not work that we do. It truly is a calling to be in our fields. And we're really excited to be able to share with you tonight what that process, what that journey has looked like for us. And most importantly, the impact that is making, as evident with some student outcomes that we're going to be sharing with you. And so I just want to really hone in on the expansion of our cross-sector wraparound supports that have taken place in Ventura County. And these wraparound supports are truly a reflection of the strong partnerships that we have with community agencies and organizations. And tonight, we have probation. Stephanie also represents the district voice. We're really going to focus on our collaborative partners, including, like I mentioned, probation. And while they're not able to join us tonight, to really uplift the tremendous work that Ventura County Behavioral Health is doing, that Ventura County SELPA is doing, that the local school districts are doing, and that community-based organizations, because each of you couldn't have already said it better than what you did. It's this work cannot be done in silos. And a quote that comes to mind is, never doubt that a small group of thoughtful and committed citizens can change the world. In fact, it's the only thing that ever has. And that is what we're so excited to be able to share with you tonight. So I am going to pause so that we could transition into Souza and Ms. Rodriguez to be able to take a deeper dive into what these partnerships look like.
Thank you,
Wanna take it first,
Consuelo.
update?
Sure.
Yeah.
So looking at, I think it's on the next slide. So we couldn't do this alone. So we have a multidisciplinary team, both at our community school. So Gateway Community School is on the left and our Providence Court School is on the right. So we couldn't do this without the help of our tremendous team. So looking at here, we have gen ed teachers, special ed teachers, school counselors, mental health specialists, the collaboration with VCBH. We also have, specialists that come in for speech or co-eds, helping students with workability. But on here, on both of our teams, I want to highlight our transition induction specialist. And that role really helps students as they enter our program. So as a student, we get an expulsion at our community school and paperwork. That person reviews all the paperwork and is the first point of contact with the district. And then they're the first point of contact with the parent. And the same for our Providence Court School. So as a student enters into the facility and is enrolled, that is the first point of contact for the district, for the parent, and for the student, because they're asking the student a lot of questions about where were you in school, what grade were you in. So it really is this trying to that foundation of building rapport and who are going to be, right behind you, supporting you in your during your time at the community school or at the court school. So really thinking about our alternative education programs, not just being, that credit recovery or intervention, but this is that first, these people and staff members that will help you get to where you need to be, credit, social emotional resources. And that's where Mr. Souza and his team come in at really helping to support that student there at the Providence Court School. And I think Mr. Souza, we'll talk a little bit about all the meetings that we have, because there is so much communication and the communication with all of the partners there in the facility. And it happens on a weekly basis, or sometimes in the hallway. If Andy and I see each other, we're like, hey, you got a second? Because we know that there's more information to be shared. And that's where we're at within our teams. We are located within the admin part of the facility. So we can just move two offices to the left or to the right, and whoever we need, they're going to be readily available to help us.
Yeah, and as was mentioned earlier about somebody retiring, right? So what's the big what's the challenge there? The challenge is sustainability. Okay, so again, I go back to the different eras that I've been here. A constant has been VCOE and the presence of Providence High School or Providence School. It's a quarter school. And to kind of paint a picture for you, if I can, you have a youth that comes into custody. A lot of our youth have been here before. Some they never have, but they are here and they're in a detention unit, a housing unit, whatever the unit may be where they are. There's a classroom. that you can see visually from where you are. So when that kid wakes up in the morning, they have their hygiene time, they have their meal, they walk into a classroom that's in the unit, okay? That is staffed by a teacher from Providence School. It's a different kind of teacher that's got to be willing to do this. It really is, to be able to, I think it's, somebody mentioned, or I think Ms. Williams, you mentioned the calling aspect of it. It really is at that point, because this is not your typical high school teaching job. Okay, they've got to reach the room that has a pretty broad spectrum of ability and capability, and they've got to be that constant piece. And what's really kind of sad but true, some of the most consistent school times our youth have is when they're here for extended periods of time. We know they're attending school. We actually graduate them, which is a huge accomplishment for some of the challenges that these youth face. And I always used to tell the kids when I worked more closely with them, you get that diploma, that's something that'll never ever be taken away from you. Because these kids have had a lot of things taken away from them. Again, I don't excuse the behavior. The criminal behavior is the criminal behavior, but there are reasons for it. And a lot of it has to do with that abandoned, abuse, neglect, and sort of cast aside. And we mentioned foster youth. So think about foster youth now that we deal with. These are now justice-involved foster youth, okay? Not only do they not have any really stability of a family, they now found themselves inside, a detention institution on top of it. We would have kids sometimes, as sad as this sounds, where this was placement after they finished serving their time because there was nowhere else for them. Trying to explain to a 16-year-old that you did your sentence, but no, you're not leaving. So that's really that really, you talk about trauma-informed care, trauma-informed treatment here. These kids have been through a lot in very short lives. As I say, oftentimes, very, very long stories and short lives, okay? So working with VCOE, having that commitment in here, and again, that sustainability, and I've got to see it. I've come back years later, and the structure's there. Even some of the same teachers are there, which is amazing, okay? The slide here talks more about what happens out in the community, the school, the SARBs. We've been doing SARBs since I've been a PO, and that's a long, long time. We're at the evening reporting centers that we have out there for our youth. We expect a lot out of probation-involved youth. We really do. We expect a lot out of probation-involved adults, for that matter. And sometimes we expect the most from those least equipped to do it. So when we're able to meet them with some of these services that are here that start inside the facility here, we have a kind of a time-honored group here we call treatment team. Okay, it consists of the probation officer, because every youth that gets in here has a probation officer assigned to them. Not a corrections officer, not somebody that's working the unit, a probation officer that's assigned to them. They are enrolled in school. They have a therapist assigned to them, okay? And they may have whatever other collaborative programming that they may be involved in. Weekly, they're going to get together, and that group, as a group, meets over these youth and talks about what's going on in each of these areas. So now we're not siloing. We're all talking about the singular youth with these different services. And then as they look to transition out, that's key, okay? I think Stephanie mentioned about the transition specialists. We have somebody here from VCOE full-time that accepts these youth when they come in, screens them, sees where they at, where were you going last, when's the last time you attended, try to sort of triage them as far as where they're gonna fit in the school here and get a feel for where they're at. But on the other end of that, we're also working with them as these sentences are winding down and these youth are getting ready to be released in the community. What school are we gonna get enrolled in school before they hit the gate here? Okay, so that's not an obstacle that has to be overcome. Make sure the probation officer knows what school he or she's expected to be attending. So now the probation officer can kick in their role out in the community, checking in with the school to make sure the kids going there or visiting the home. They're going to be visiting the home anyway. And if they're not, finding out why, what's going on. So the reception part of it starts here. The groundwork is done with the kids in the school here. And then the focus is on what are we going to do when they get out? That transition is so difficult for incarcerated adults, let alone incarcerated youth that are struggling with a lot of their own issues of simply being an adolescent. So, and then an adolescent where there's homelessness, where there's drug addiction, where there's illness, where there's abuse, where there's parents that are absent or a big part of the problem. And all those things add up to the odds stacked against them, to be candid with you. So when we're looking at it collaboratively, I look at working with VCO, with our school people. I look at working with our behavioral health people. I look at working with our medical provider that's here full time. We spend a huge amount of resources on it. You know, we're next door neighbor to LA County that is this big behemoth of an operation, but we're so contrasted in the ability that what we're able to do. When I got up this morning, there's 40 kids here. If you know our business, that's not a lot. To give you a contrast, this place was built in 2003, 2002, 3, opened in 2004, 420 bed capacity. The most we've ever seen was back when I was here in 2007, was about 240. The Juvenile Detention Alternatives Initiatives has come to fruition here, and we're only keeping these youth that we really need to have here, okay? So what that means is the numbers are low. The numbers are manageable so that we can give these kids the resources and really work in a collaboration with all these different things. Have these MOUs. We spend a lot of money on behavioral health, spend a lot of money on medical care, a lot of money on VCOE and our contract with them, because we recognize that that's where the need is. So I could go on and on, but I'll try to stop myself here. But it really is something, you know, that I've enjoyed. I've spent probably a third of my career working with youth, and it's certainly the most rewarding part of it. It really, really is. Sometimes it's real sad too. I mean, it really is. You got to have. It can be hard to see some of this stuff in terms of knowing what these kids are dealing with. And then most recently, I'll step away from SB 823 has really changed what we're doing in here. I have youth in here that are older than some of my staff. Okay, they can be here until they're 25 years old. So we've had to retool, and this is maybe not so much a VCOE thing as it is a continued education thing. But we have a school counselor in here to start letting them know what they can, what's available to them out there. We've had a couple kids complete their AA degrees while they're in here. I'm working with the chief deputy, the public defender right now on a thing called Project Rebound that the Cal State system is starting to find scholarships for these justice involved youth and the right ones to get them out. We have these kids for years now, where the California Youth Authority used to have them. They're closed, they're done. They closed the doors. We're all back. They sent ours back here, and then our serious and violent folks that are our justice involved youth are with us. So what are we going to do with them? Because they will be out in the communities again.
I always appreciate. Oh, I'm sorry, Andy. I thought that was
What?
I'm so sorry. You know, I always appreciate when Chief Deputy Souza always uplifts that data point for our county, where in the early 2000s, we were at our highest capacity with the mid 200s, and how our trend over the last decade has been 80s, and now these last 5 years in the 40 trends for enrollment. And that's a reflection of what Andy was really underscoring, that one partner is never more important than another partner. That all partners within the wellness system, all partners in Ventura County, all fully embrace that we all engage in shared leadership to really maximize how we're braiding our funding, how we're really leveraging whatever initiative ever ends up coming down the pipeline for that particular year, and how we're really leveraging the different funding sources within each agency. Because when we sat down to do this work back in 2018, the first thing that we started with was, let's sit down and as agencies and as partners, let's all look at our mission and our vision statements. And when we took time to have that conversation, it was amazing to see how we all share common visions. We all share common metrics in our different accountability, same goals in our different accountability plans, and how there was that opportunity since 2018 to really bridge all of that. So I always appreciate Chief Deputy Souza, you always spotlighting what is a reflection of the student testimony at every single graduation. Historically, we had students who would come to their graduation day, because in our court schools, our graduations happen throughout the year. And the student testimony used to be, I never thought I was going to graduate.
Yep.
To recently, I never thought I was going to graduate, and I never thought I was going to be a college student.
Yes.
And so that is a significant shift in our county. And before we take a deeper dive into outcomes and our metrics that we've been using, I want to transition into the conversations focusing on AB 2083. And I'd love to invite Mr. Winters to take the floor.
All right. Thank you so much, Dr. Hernandez-Williams. Good evening, everyone. Mike Winters, again, Director of Student Services at Ventura County Office of Education. Super excited to talk about the very robust wellness system of care that we have here in Ventura County. It gives me such great joy to hear others hearing about the great work we're doing, and it's really, really a great system. So just a brief history of our wellness system of care. After AB 23 and those mandates, we got on the ball here in Ventura County. We formed an interagency leadership team, of which I represent Ventura County Office of Education on. We signed our MOU with those 5 required agencies and have since added a few more agencies to our ILT. We implemented agency-wide ICPM training to make sure that we are all on the same page as far as really working together. Our motto really is, when working with students and families, every door that's what they come upon is a right door, right? There's no wrong door for our students and families. We also developed a comprehensive prevention plan. We have our executive advisory council that works with all of our agencies and our VCOE team really to best support our foster youth. And just so you're aware, our system of care, our governance structure is such that we have our ILT, as I mentioned, our interagency leadership team. We have a wellness system planning committee, wellness system collaborative, and then we have a number of work groups that are working on things like shared metrics work group. How are we going to, as agencies, work together with our Ventura County Community Information Exchange to do that shared data. We have our ICPM practice and systems work group, family level data sharing work group, and then our community pathway design work group. So we've really done a lot of work and just continue to work. Tomorrow we have a meeting with all of our leads and really looking at where we've been, where we're going, and how are we going to build sustainability within our system. So we can go ahead and go to the next slide.
Before we go to the next slide, we'd like to extend a warm welcome. And if any of you are in Ventura County, you are more than welcome to join us at our county office in our salons to share space as we're going and celebrating this year and preparing for next year.
Absolutely. Thank you. Wanted to talk a little bit about our foster youth support, and as outlined in AB 23, that's an important tenet, right? And it's been talked about a lot, but in Ventura County, we have 247 foster youth currently, but I really wanted to highlight that since 2021-22, we are just above 400 foster youth, and we've come down over 150 foster youth since that time, and that's really due to the coordinated work between VCOE and child welfare, and really trying to look at the needs of each student and finding placements for students with family members or with a relative, just really so we can prevent students entering formal care if at all possible. So our numbers are going down, but that's a good thing. We have great partnerships with our 19 school districts and 12 charters, and our district liaisons are the backbone of the support that our students have at the district level. Of course, transportation to school of origin is important, and we've really talked a lot. I know Deputy Souza has talked a lot, and our presenters have as well, about the trauma that many of our students face. And so we have a coordinated system of professional development for caregivers, CASAs, for school staff on trauma-informed best practices. And we really try to keep that at the forefront so we can help all of our all of our folks work to their best capacity with our students. I think one of the strongest supports we have in place is we have a dedicated staff member in our foster youth services coordinating team that works with all of our 12th grade foster youth, knowing that after their 12th grade year, they are going to transition out into their post-secondary world, right? So this is someone who meets with each student early on in the school year, takes a look at transcripts, makes sure that they're not credit deficient, works with counselors, and then as we get closer to the end of the year, works with FAFSA or CATA completion, college applications, trade school applications, employment assistance, interview prep, right? All those supports that we want to make sure we can instill in the students again before they transition out of high school. And then we have a number of events that students will participate in at our local colleges and universities, Dreams to Degrees, college tours, computer camp. And then we have a great scholarship program that we're really proud of. It's in collaboration with the Teach Committee here in Ventura County, and we work with the Ventura County Community Foundation. And it's a fund that is built each year just to support scholarships for foster youth. So last year we had 47 foster youth who received a scholarship, and we're on track this year to provide 60 of our foster youth who are either graduating high school or are already in college support with the scholarship. So really proud of the work that the team does, and I can't stress enough how great the collaboration is here in Ventura County. And this is year 30 for me in education, and really, as has been mentioned, the purpose of everything that we do is just really to best support those students so we can give them the best life possible. So with that, I will go ahead and turn things back over to Dr. Hernandez-Williams. Thank you.
Thank you, Mike. And we really want to honor the agenda and the time frame. So we're going to spend these last 2 to 3 minutes of briefly going over the last 4 slides that we have. What you see projected here are the academic, behavioral, and health programs that Andy was highlighting earlier, as well as Stephanie. And what you heard Mike also mentioning. And one of the areas that we haven't spotlighted yet is our partnerships with our higher ed partners. And because of these partnerships is why students are now college going students. 100% of our students in our facility have access to the same courses at the community college that our general population has. And Stephanie is going to be sharing the outcomes that we've been experiencing because of these recent partnerships.
So this is our enrollment for 2025. And what we've really been working on are significant progress with suspensions through restorative practices with our counselors. All of our teachers are also trained in trauma-informed care. And then this is all in collaboration with mental health specialists, VCBH, and really to help students. We want decreased dropout rates. We want decreased suspension rates. We want to increase that dual enrollment. And as Dr. Williams was sharing on the previous slide, really working with our community college, but also our higher level colleges, local colleges. So we have Cal Lutheran that comes into the facility and at our court school. And we also have Cal State Channel Islands. So we're really working on giving kids, not just their, as Chief Souza was sharing, that yes, we want them to graduate, we want them to earn those credits, but there is more. But wait, there's more. And so bringing in Project Rebound, like Chief Souza was sharing, we have presentations for our students, and then increasing those graduation rates. So right now we do have, and we just shared this data point earlier today at our branch meeting, we have 12 seniors currently in our facility. And out of those 12 seniors, we have 9 who have already graduated. So really working towards what do those students need to earn those high school graduation credits and beyond? What are those next steps? So we want to increase those college going rates and then having civic minded graduates. So that's where the partnerships with our community-based organizations, with public health, with probation really help us as they re-enter into their community. What else can we do to help support them?
So as we wrap up, we want to share with you the impact that this has had over the last 5 years. And you'll see for yourselves our baseline data, our graduation rates, and our college going rates. All of that work would not be possible without the support of our county superintendent, our county board of education, our partnerships with all the agency leads. And it has been such a privilege having an opportunity just to spotlight some of the promising practices that we've experienced. And we will pause for tonight. Thank you for inviting us to join you. And we'll open it up for any questions or any items that you want to take a deeper dive into.
Thank you guys for your very enthusiastic presentation and great partnerships. Pretty obvious that you all seem to work really well together, and the outcomes you shared were impressive. I kind of want to turn it back to Elizabeth to maybe make some final comments. And I know you had some facilitated questions. We wanted to leave time for some audience questions and some discussion. I know you had some good questions for us to look at. And you're on mute, Elizabeth. I don't know if you know that.
No, I did not know that.
Okay.
Thank you. Yeah, I was trying to get back into the slideshow. Can you all see this?
Yes.
So I have a Fresno County shared leadership work here too, only for your reference in your slides, not for discussion. But we wanted to talk about some of the questions that you might ask. Well, first of all, let's just talk about, we had questions about like, what does this make you think about out in the field around your county, how this work is happening in your county, how might it impact, students in juvenile halls and court schools and the foster care system and students with disabilities, and just have a conversation about really any questions that you have on the presentation for a couple minutes here. So that would be my starting invitation for anyone who's joined. Yes. Louise?
Hi, thank you for this presentation. It's very informative and wonderful. You show some dramatic results in your decline of students who are in your court school and also in foster care. We've seen kind of this trend around the state, but Mr. Sousa said something really significant, is the state kind of folded up their involvement in the juvenile court, that whole system, and gave it back to the counties. And I'm just wondering if some of this is an artifact of other policy decisions that were made, and how you navigated that change in Ventura County.
I can tell you from our end of it here, it was a foundational shift. The only thing I would compare it to is 15 years prior with AB 109 when Governor Brown realigned the state prison system. Okay, very similar concept applied to the juvenile one. When I first came into this realm in 2000 or mid 2000s in juvenile work, the state of California had about 10,000 youth inmates through 10 different facilities. The last one closed in Camarillo a couple of years ago, finally shuttered it all. So that was pushed back here. So what are we grappling with now? Much of what we talked about in the presentation, especially the early collaborations with VCOE, was kind of in place. We have to kind of shift this now and say, okay, we're not going to be, these youth are not going to be leaving our care here at 17 or 18, or at 19 was the magic birth date and you went to county jail when you were with us. This is all, I'm going back a little ways. Now we've got them into their mid-20s. What do we do? They're graduated high school. You saw the graduation rates. Okay, now what? And it's the college piece that's really been what has changed. Our focus has shifted in that direction. Foundationally, we were there with Ventura County Office of Education and Providence School, and those systems were all in place and working well. But what if this kid comes to us now back from a facility in Stockton. He's already got his high school diploma, but he's got 4 years left on a baseline sentence. Okay, so what are we going to do with that youth to get them educationally as far as what can we offer them? And that's where VCOE came in, was helpful with us. And I'm going back a little ways here, my time here in a different role, but working with the school counselor, liaison. You saw the mention of the community colleges there. That was not always the case. Okay, that was a recognition that we needed to kind of retool in terms of not just thinking in terms of a high school diploma, which is great. Don't get me wrong. I mean, that was our goal. It still is. But what are we going to do beyond that now? Because now we have these youth, because of the change in statute, because of the change in law. And I've been at this almost 30 years. That drives so much of what we do in this business is changing laws and statutes. Everything's an SB or an AB, all right? And it changes what we do, all right? It just does. That's just the way we work. So I think we've become pretty good at trying to understand the implications as it works its way through the legislature. We're talking about it going, hey, this one looks like it's going to pass. We better get our stuff together and figure out how we're going to deal with it. So yes, it does change our focus, and we are changing statutes oftentimes drive changes at the local level for us here. I will say this, when we've talked about this whole relationship that we have here in Ventura County with our collaborative partners, I've been around the state over the years quite a bit. Not every county does this. Not every county has either the resolve, the resources, or the structure to pull it off. You have some counties up north where they don't even have, you have 4 counties sharing a juvenile hall. They're sharing beds, okay? They're just trying to get people, that are in the basics, get them housed and get them fed, where that other piece is. I've talked to other partners and in my business that what we have down here is a luxury. It shouldn't be, but it's seen that way at times. So I hope that, Louise, that helps. But yes, we're often driven, and I think we're pretty good. We've become pretty good and pretty adept at changing based on statutory changes that come down our way. Thankfully, with SB 823, which we were talking about here, this one actually came with some money. Okay, so that always helps. It helps a lot. So we were able to use those resources in a way that going to be beneficial to this. Age 25 is a different feeling for us. Okay, I've got kids in here as young as 14. I gotta be real careful about how they're housed and who they're with and the influences that are there. But at the same time, that 23-year-old is going to be in our community. That's a fact. So how are we equipping them? So I saw there was another hand up, so I'll stop on that question.
Questions from Rachel or anyone else on the call? I had a question about AB 2083. Well, I was curious, are these collaboratives or interagency coordinating groups required to publish a plan with outcomes, and who do they report to? Do they ultimately report back to the Board of Supervisors? I could say as a county board member, school board member, I've never, it's the contract, the MOU for our role in AB 2083 has never come to our board. We've never had a report from the AB 2083 committee. I mean, we do get reports from our staff about our court and community schools and our foster youth programs, but I was just curious, like as elected trustees, how we could more monitor, engage, help create partnerships with our fellow county board members. So anyway, Diana, I'll let you.
Yeah, no, it's a great question. I mean, so to answer your initial question, no, there are no required outcomes or ongoing reporting. We would probably have to advocate for some money if that were to happen. So what AB 2083, and let's just sort of look at it today in today's terms, because it has evolved, and it's evolved in a really good way. It creates the structure by which child and family serving agencies can come together and collaborate and can coordinate and can leverage each of their services. Just like we don't have elected boards of education, we also don't have boards of supervisors, right? So the mandated entities on these 2083 teams are all beholden to these other elected officials. And that's okay. What we would hope and expect that they are doing, like my county human services director and or child welfare director that's on the team, I would expect them to go to their board and not necessarily say 2083, our team says we think we should do this, but really to just sort of, share like from a systems perspective, we're collaborating with education. And this is the outcome that we would like to see happen. And this is how we think the board can support like our recommendations here. So I think it's okay that 2083 is sort of invisible because it's really the sort of invisible mechanism from which folks that are on the ground implementing can make things happen. I don't know, Elizabeth, if you'd like to add to that.
Yeah, sorry, my power just went out and back on, so I'm back. And I can't screen share anymore, but this is the perfect last question, I think, and the point of all this. I completely agree with you, Diana. One thing I would say, I think county board members of education can do, and other agencies, is really ask questions, Bina, about like, do we have this structure, and is this happening in our county, and if so, how is it working? Like, how is it going? And what else might you need? I think that board members can be, as you pointed out in the beginning of this presentation about the role of your association, can be advocates for the work expanding and being supported by the state so that it can continue in the counties, because it is really important. It is really important work. So I think that's really the role of board members can have. And to your point, many of them have never even like heard of this. So, and there isn't a person in any system that I've worked in, and I've pretty much worked in all of them now, that won't say this work of collaboration, coordination, alignment, and integration is like some of the most important work that we need to be doing for young people, period.
Right. I mean, I think your added piece is very important. We don't want it to be completely invisible in that respect, but we want every member on those 2083 teams to be active and to feel empowered to do the work. I have seen, for example, some awesome work in Yolo County from that superintendent that is making things happen through by being that conduit with all the various school districts. Would not have happened without that one person really championing it. Do we have those champions that are on those 2083 teams on the education side that are active, engaged, and empowered?
Also, and Garth is like such a close friend and champion of this work. I would say, I think education is uniquely positioned because on the health and human services side of the house, they all work together more than they do with educate. We have two super agencies in California. We have HHS and we have education, and within HHS is behavioral health and child welfare and juvenile justice, and then we have education. If education becomes educated about this, then I think that we can be advocates for it. We can play a really meaningful role in it. We have all of the children in our systems. We can be much more effective at prevention work and also at transition work as students are coming out. But we can't if we aren't uniting across our agencies. It's just not. We have to make it our intention, and I think education's role in that cannot be understated.
I think we had a great example tonight of a county office that is and a probation department that are very committed to collaboration. Unfortunately, we're at 8:30, so I think we don't have more time to ask more questions, but we appreciate all of our speakers, and I think that we've just kind of got to the tip of the iceberg on this conversation, and I hope that we'll have more opportunities, particularly as we work with the county, as ACCBE works with the county soups, to look at other ways to see how our county boards can support this integrated approach. And with that, we do have a little evaluation if it's in the chat, if you guys would be willing. And then we just want to make sure, I'm going to just make sure we have our in-person conference coming up in May. And then we have, this is in Ukiah. And then if you go to the next slide real quick, just to show you a few other things we have coming up. There's the evaluation. And then here's some other trainings we're doing for county board members. I did want to point out one that may be of interest to more than just our county trustees is we're looking at hosting a session on the new study that just came out around Rethinking California Alternative Education Systems. Just came out from UCLA Transformation Center. So we'll be getting the word out on that, and that'll be open to not just county trustees. Anyway, I'd like to thank all of our speakers. Thank you guys. You all were awesome. And again, this is recorded. We will push it out to our members who were not here today. And we're just grateful for all the good work that you guys are doing. So thank you.